first session is going to be, today's session is going to be about what calcium and vitamin D do for us and when we need it, how much we should be taking, and also a little bit about calcium and vitamin D supplements. And then the second session will be about the food. Yeah, it's going to be more about where can you find calcium, what are the food sources. And the last session, and we're actually going to sort of play around with some food samples, if you will, not real food. The last session will be about reading food labels so you can make some good choices related to calcium and vitamin D. But the thing about the food label session is it's something that you can apply to any nutrient. So once you know how to read that label, you can make some really good food choices when you're in the grocery store. Plus you can compare one item to the next. So that's sort of what we're going to cover over the next three sessions. The information that I'm giving you today is general, basic information. If you have already discussed calcium with your family physician or your healthcare provider and they've made certain recommendations, my advice doesn't replace that, because your situation, your health needs might be, might require something different. So, if your family physician has recommended something in particular for you, stick with that, but there may be some helpful information here that will, just increase your knowledge about calcium. Does that make sense? Mm-hmm. Okay. So, how many of you get most of your calcium and vitamin D from food? How many of you take supplements?
I take a lot of supplements.
Okay. Good. We'll talk about that, and we'll see if you have any questions based on the information that I'm going to present to you about the balance and the balance with a supplemented food. So I think we all know. When we think of calcium and vitamin D, we think of our bones and our teeth. We know we need it for strong bones and strong teeth. But calcium, they also do other things, and particularly calcium. It actually helps our heart function properly. It helps our muscles fire properly, and the nerve impulses. So calcium plays actually quite a critical role in our body, and it's so critical that if we don't get enough calcium intake, if we're not taking in enough through either food or supplement, our body will take it from our bones. It will, because that's where the calcium is stored. So if we're not getting enough in, it goes to the bones to take the calcium it needs, because it performs a very critical role in our body.
It has nothing to do with osteoporosis, though?
Well, if it starts to take it from your bones are going to get weak.
Yeah.
Okay? So that's why,
I didn't realize that could cause osteo.
Yes, it can. It can contribute. There are other risk factors for osteoporosis, but it can weaken your bones. And particularly if, over a period of time you haven't been taking in enough calcium. Okay? And vitamin D also helps the body use and absorb calcium. So if you're taking calcium in, you need to be taking in an adequate amount of vitamin D so your body can actually use the calcium. So the two very much go hand in hand. Okay? So this is just a diagram comparing a healthy bone and a bone with osteoporosis, okay? And you can see that the pores, if you will, in the bone, they're larger. So it's just going to mean that that bone is not going to be as strong, right? Okay. So the thing to know is that the bone is actually, it's a living tissue, okay? It's not, some people think of bone, well, it's, you know, it's this dense, hard thing, and it doesn't really do anything. But it really is a living tissue that is constantly renewing itself, okay? So we actually have cells in our body that go to the bone, and, you know, because just everyday wear and tear destroys some cells on the bone. And we have some cells that go in and clean up the bone, and we have other cells that go and deposit the calcium and rebuild the bone. So it's constantly renewing itself. The problem is, as we get older, those cells are still cleaning up the bone, but the cells that renew the bone, they can't do the job as well. And that just is something that happens with age. And we also don't absorb the calcium as effectively.
Because of age?
It's just, yeah. So, because that happens, we really do need to make a conscious effort to do whatever we can to make sure we're giving our body as much calcium as is appropriate, right? So, because we want to do what we can to keep the bone strong. And you also know that physical activity, right, keeps your bones strong. You need that weight-bearing activity to keep your bones strong as well. But that's, you know, today we're talking about calcium and vitamin D, so it really is important because as we get older, that bone renewal is not happening as well, and we're not absorbing calcium as well. And because of that, we're more prone for fractures, right? If the bones can't stay as strong, we're going to be more prone for fractures. Just a couple of stats about osteoporosis. It isn't just a women's disease. Men can get osteoporosis as well. But 1 in 4 women over the age of 50 have osteoporosis, and usually it's typically around 1 in 8 men have osteoporosis. And osteoporosis means essentially that you know, the bone is a little more porous and it's going to break more easily. It's just not as strong. The mortality, I don't know if you know, but mortality rates from hip fracture are actually quite high. And 50% of the people who do get a hip fracture never completely recover fully. They may be left with some sort of disability, whether it's pain or limited mobility, that kind of thing. And overall, that just sort of reduces quality of life. And fractured hips also account for about 40% of admissions to long-term care centers. If you sort of look back to how somebody wound up there, 40% of those individuals, could be related to a hip fracture.
I discussed this with the lady that used to live next to me, and she said, from what I hear, people who break their hips, usually their hip was already broken in the first place. It's just that there was a weakness there, and because they have osteoporosis, and if they didn't know, the hip was.
Men can often go undiagnosed, but they can still be at risk for osteoporosis. With men, sometimes it's more their hormone, testosterone. It does protect them somewhat. And yes, as they age, that does drop. But it's with men, oftentimes it's more lifestyle. So things like smoking and alcohol, those things can affect your calcium absorption. How many of you have had a bone density test? Good.
I'm ready for the year.
Good. And it's good to have, because once you have it as a baseline, then they can see the next time they do it, they can compare. So, what do you need to know about calcium?
It doesn't come with that little dog.
It doesn't, no, it doesn't come with the little dog. So the daily recommendations for women over the age of 51 is 1,200 milligrams. And the upper limit is 2,000 milligrams. And we're going to talk a little bit more about that. In case there are men in your life, it's a little bit different for men. So 51 to 70, they only need about 1,000 milligrams. If they're over 71, then it becomes the same as women over 51. It's 1,200 milligrams. And the upper limit, again, is 2,000 milligrams. Now, only one of you is not taking a supplement, right? Okay. So if you're getting your calcium from food, and let's just assume that you're getting enough, you don't really have to worry too much about that upper limit. Okay, because you'd have to be drinking and having a lot of milk products to get 2,000 milligrams, okay? And, it's the way your body absorbs that calcium from food, it's easier on your body anyways. The calcium that you take from a supplement is it's a bigger hit to your body. It's almost sort of like getting a mega dose all in one shot. And I don't know if you've heard in the news lately, there's been some new research where there, mega doses of calcium in one shot, they're questioning whether there might be a cardiovascular risk. Yeah. So,
Scary.
It is scary.
They say to cut it in half.
Yes.
Cut the tablet in half, take one and the other.
And again, it will depend on what your physician has recommended, and whether are you taking your supplement based on a recommendation that your physician is giving you, or are you just taking the supplement?
What time of day should you take it? Because it says to take it, if you're going to cut it in half, take it twice a day. I mean, is it before a meal, after a meal?
It depends. This is where it gets, this is all the questions, and these are great, because this is where it gets a little complicated. There's typically the two common sources. And you know what? Don't let me forget. Once we get to the supplement slide, we're going to talk about all of that, because there's a lot to know.
Information.
Yeah, there's a lot to know actually. Just for your information, there's a Canadian health survey, and hi. Go this way, because I want you to trip over the cover. There's actually there's some lots of chairs here. So how are Canadian seniors doing in terms of their calcium intake? Not very good. So over 80% of Canadians intake.
They're
Yes,
not,
they-
they're not this, or?
No. I don't know what it is. I guess they don't like milk products. I don't know. I don't know why women would be better than men, but missed an important piece of information, and that's what's recommended in terms of your daily intake. It's 1,200 milligrams and not more than 2,000. And it'll be on, yeah.
About the milk, I thought that there's such controversy about milk products. You know, how as you age, you don't need as much because, you know, it's made for babies, you know, and that you don't really, you could have maybe yogurt, but milk, like, it's like harder to digest as you get older.
Well, but we're going to talk, next week when we talk about food sources,
Okay. We'll see.
you'll see
Okay.
what the difference is in terms of how much you get from milk
Okay.
and yogurt, and how much yogurt you need to eat to get the same amount, okay?
One candidate for women, one class is equal to
We're going to talk about that next week.
yeah.
Yeah.
Today.
Today, we're just going to talk about in your body, other than giving you strong bones. It's for your heart, your muscles, your nerves to function properly, and that the job it does is so critical that if it doesn't get enough, it will go to the bones.
There is a conflicting conversation.
Can you speak up again, hear you?
One they say you need the calcium for your bones, and others they say it's bad for your heart. So who we believe?
And we're going to talk about that when we get to the supplement. My recommendation, if you can get most of your calcium from food, that's the best way to go. But you have to, and next week when we talk about food sources, you'll get an idea of, like, am I taking in enough food or am I not? And there are reasons when, and we'll see it soon, when you might have to consider a supplement. Because yes, you're right, some of the research is saying that a mega dose through a supplement can cause some cardiac issues. You can split your supplement up, take it in a smaller dose, because it's the mega dose that you're getting that is the concern around the supplements. So other things that affect your bones, caffeine, so things like coffee, tea, and colas with caffeine can interfere with calcium absorption.
Oh, rats.
Yeah. Salt. So this is another reason why if you're purchasing foods that are processed at the grocery store, you should be looking at that sodium in the food. Okay, and in the last session when we talk about labels, we'll talk about what's too high and what's okay. All right. We already talked about exercise, so we need weight-bearing exercise for strong bones. Alcohol. So somebody who drinks heavily, alcohol can interfere with calcium absorption as well. And smoking. So when we talked about men and their lifestyle factors, typically, not all men, but those who do have osteoporosis, for a large number of them, it can be due to some of these factors. So calcium supplements, when would you need them? Well, it might be needed if you have a lactose intolerance or an allergy. And do you know the difference between lactose intolerance and an allergy?
Lactose intolerance is when when they drink milk, they kind of get
It doesn't agree with them, that's right. It's an intolerance. So they might get, you know, cramps, they might get gas, they might feel a little nauseous, they might have the runs. Those symptoms can be similar to symptoms that you can get with a milk allergy, but usually there's also other things. An allergy is when your body is reacting, there's an immune response to the protein in milk. And so some of the other symptoms, they might get swelling, the throat, they might get watery eyes. So there's a huge histamine release in the body because the body is responding to that. Just like, you know, the same thing, people get a bee sting or they're allergic to something else. So an allergy is a much more serious situation.
Can I make one comment?
Yes.
The lactose intolerance, sometimes it's intolerance when you take milk, for example, for calcium by itself. And as an example, I give my mother who was not able to drink milk by itself. She had that some feeling in the stomach and nausea, etc. And I started giving her with food. Okay. And she tolerated the food.
Yes.
Wow. Yeah. So that's my comment.
Yeah, and it can, different people have different levels of intolerance. Some people, even in baked goods, like I have a colleague who, if she's going to have a baked good with milk in it, like she'll take a lactate. Because otherwise she'll have the gastric symptoms.
How could she have the milk with food? I don't know what that happens.
What do you mean?
The mother can have milk but with food.
Yeah.
How can the body affect it with food but not?
Well, the stomach is an amazing thing. And sometimes just having something in your stomach will alleviate those sort of nauseous type feelings. So,
Maybe
you know, everybody's a little bit different.
Yeah.
You know?
And your tolerance and intolerance, it's all a little bit different.
Yeah. Like in tea, she would have it, and that's fine.
Yeah.
But not by itself.
And maybe it's the volume.
Maybe.
You know, maybe it's the volume of milk. Some people don't like drinking milk. Some people have told me, like, I can't drink milk. You know, they can't even swallow it because they just don't like it. Some people might be vegan, so that means not only are they're not eating any protein source from an animal. Right? So that includes eggs, milk, meat.
That is very interesting.
The vegan?
Yeah, because protein from any vegetable source, no, animal source. Humans are animals. Children drink milk when they are born, mother's milk, which could be classified technically as animal milk. I don't understand the rationale there.
It's a personal choice. Some people, and some people feel, you know, very strongly about that. Some people base that on an ethical decision. Some people, it may be on a health reason. There's a lot of different reasons.
What would be the ethical reason?
They don't want to cruelty to animals.
Yeah, my girlfriend's mother-in-law is in India, and they don't take any. I mean, she won't even eat a piece of cake because anything that comes from animal is a no. Not even a piece of cake. Everything is beans and rice. That's it, and other things. But it's very religious based. Especially if you've been raised since you're a little kid. You know, it's hard for us to understand, but it's how you're raised.
That's right.
It's not her fault, you know.
Some vegetarians, the question here was, is there a difference between being a vegetarian and a vegan? A vegetarian, they couldn't drink milk or eggs.
Or chicken, some.
Fish, yeah. So the vegan is like nothing, there's no milk, no eggs, no, yeah.
But actually, in terms of vegetarian,
Uh-huh.
they do not eat fish. Strict vegetarians do not eat
Yeah.
fish or eggs.
And it's the same thing, right? It's all on a continuum in terms of
On the line.
what, yeah, where, how far people go with that.
I know I had a dentist like 25, 30 years ago who was very anti-milk. And because he had studied children that he had studied, this is like 30 or 40 years ago. He said that the teeth, let's say you went down to Haiti or any islands, the teeth were stronger because they didn't have any milk. He found because the child was cut off from the milk after a certain age, that's it. He found the teeth were in better condition than North American.
No, I don't think the teeth.
Yeah, I know.
Sweets, like not.
That's what he told me. And I was like, are you
Yeah,
sure?
it could, but you know, there's so many variables, right, that could affect that, I imagine.
Well, don't forget, this is like 40 years
Yeah.
ago, and this is an
Yeah.
older man, he was about 80 years old at the time, and maybe, his studies then,
Yeah.
it's different than now. you know.
It's also hygiene. In many of these countries, we just don't have this toothpaste and toothbrush. They take those trays, they go on, they chew on it, they kind of brush. So your teeth are much stronger.
Yeah, that's true.
And one of the other reasons is why you might need a supplement is obviously if you have or you're at risk for osteoporosis. And that's something your healthcare provider, your family physician, would go over your risk factors and that's something you could always discuss.
Briefly, can you have pain if you have osteoporosis?
Pain?
Pain.
It's pain.
Pain.
It's not the same as osteoarthritis.
Okay.
Right? So,
That's what I was wondering, because my mother lady, she's in pain, and just, maybe it's my osteo. I said, I've never heard of that. Pain because you have osteo.
so
You can.
yeah.
I know that she has arthritis.
I'll give you another diagnosis. I had osteoarthritis in my two thumbs. That hurts. And it was painful, painful.
Osteoarthritis is painful, but it's different than osteoporosis.
Okay.
Okay.
So the supplements and the upper limit. Remember you asked the question earlier. So this is where it gets a little bit tricky. If you take your supplement, when you go home today, I want you to get your bottle out and I want you to read the bottle. And because the supplement is usually it's a compound made up of a few things. Okay? So look at it, and you should be able to see something on the label that says the amount of elemental calcium. Because when you buy your bottle and it says 1,500 milligrams, right away I told you 1,200 milligrams. You're going, well, why the heck would they sell me 15? Because the body can only absorb about 500 milligrams at a time. Okay? So, and this is the complicated thing. When you're on a supplement and you're calculating your daily intake, it's the elemental calcium. Because that's the pure calcium.
Sorry, just to see the clarification.
Yep.
Elemental.
Elemental.
Or element.
E-L-E-M-E-N-T-A-L. Elemental. Okay? So that's the pure calcium that's in the supplement that you're taking.
And no more than 500 milligrams.
Well, 500 milligrams is what your body can absorb. I looked at mine at home, and the caltrate that I'm taking has 600 milligrams of elemental calcium, but it's like I think it's a 1,500 milligram tablet. Yeah.
What about this difference between, that's one thing I always like, calcium nitrate, and then there's calcium something else.
And that's the next thing I was going to tell you.
Because the doctors tell you, and if you don't write it down and you get to the counter, you go, which one was it?
There's the two most common are calcium carbonate and calcium citrate. Calcium carbonate has about 21% of elemental calcium in it.
Which one?
Carbonate.
Carbonate, yes.
Calcium citrate has 40% elemental calcium.
But you need several tablets, this is the problem. Calcium citrate, when you read how much you take dose, it says 3 times a day.
Well, I think, if you're on a supplement, I would recommend for sure you discuss it with your family physician, but also consider how much on a typical day you're getting from your food. And next week, once we go through the food, then you can judge for yourself how much you're getting. Again, if you're getting all your calcium from food, as long as you're getting sort of the recommended daily intake in general, don't worry about the upper limit. Your body's going to absorb that food, that calcium. It's easier on your body. And through food, you're probably never going to get to the upper limit unless you're drinking gallons of milk a day.
So which one is good, citrate or?
They're both good. It just you're getting different amounts of calcium. And this is where this gets confusing, right?
Caltrate.
I think,
doctor told me take only caltrate.
and the one I'm taking is caltrate. I think the bottle says 1,500 milligrams, but when you look at the label and you read, it's about 600 milligrams, the one I'm taking.
So the caltrate, is that a carbonate or a citrate? There's calcium carbonate, calcium citrate, and then there's that caltrate brand that you're talking about? That's the brand?
That's the brand. Caltrate is a brand.
Okay, and then is that considered one or the other?
I think, it doesn't matter.
As long as the percentage of the elemental?
Exactly.
Okay.
Okay, just be aware
That the amount is different.
that the amount is different.
Okay.
And if you're taking it because you're trying to meet daily recommended value, then, you need to be aware what you're taking in. So that 1,500 milligrams is not all pure calcium that you're taking in.
No.
Right? Okay?
Is that for fillers?
I don't know why it has to be in a compound, but that's just the way they produce it, and for whatever reason.
Sorry, can I ask
Yeah.
you, what was the percentage you gave in calcium citrate?
Citrate is 40%.
40%.
Yeah. And the carbonate. And if I'm correct, I think the carbonate, which I think is what caltrate is, they recommend that you take it with food.
Yeah.
And the citrate, it doesn't quite matter. So again, you really have to know what you're taking. It is complicated. It is complicated.
Does that include the liquid form too?
I don't know. You have to look at the bottle and see if it's citrate, if it's carbonate, take it with food. If it's citrate, I don't think it matters whether it's liquid or tablet form. It might. I mean,
Three times a day, that one.
yeah.
It has
But
300, I think.
If it says 300,
Yeah.
then and 3 times a day, you see, that's why they're recommending. Yeah.
Okay.
Now, the other thing is, though, if you are having milk. Let's just say you're going to take your supplement with a meal, and you're having milk, or there's yogurt, or there's a major milk product there, a good calcium source. Don't take that supplement with your milk. It's too much. Your body's going to get rid of what it can't absorb. So you might as well, you know what I'm saying? So take your glass of milk and then take your supplement at another time.
How
because-
much of a gap should there be?
I don't know. You know,
Maybe better to take at lunchtime because
Yeah.
in the morning I have my cereal bowl
Exactly.
and I take my calcium right after.
yeah. And calcium is water soluble, so you're gonna pee out what you can't absorb.
Maybe,
Okay.
maybe take half during the day and then, I don't know how hard it is on your body to take calcium before you go to bed. You
Yeah,
know,
that I do.
they say your body absorbs everything at nighttime because your body's at rest.
Yeah, again, if it's you know, the carbonates, you probably want to take it for sure with a snack because it'll
It'll be right there.
I've done that, and if you don't have something in at night, it doesn't sit well.
I do it like that, but doesn't bother me.
Oh, good.
What did you say?
Good for you.
I do it, stuff as well.
Me too. Some people
That's
are
right.
like, good
You're
too, I
right.
don't know. I just
Yeah.
take it.
I take it first thing in the
But,
morning.
but,
You still have weight.
what is it?
Calcium that you buy, for example, say from the supermarket,
Yes,
they're brand name.
yes.
I haven't checked about the carbonate or the citric level in there, but are they just as good as any other brand names, or should one be going with a certain brand which is better than other, or not really?
Not really. You just need to be aware of how much you're getting. And, you know, don't take it with the bowl of yogurt or a glass of milk because you're wasting your money then.
Yeah, that's
Right?
good to know.
Because
I never spread the word.
I learned something. You can only absorb about 500 milligrams at once. You can, and the reason we had the slide with the upper limit is because you can get too much calcium. Okay, so you don't want to overdo it either. Too much calcium can cause health problems.
Yes.
So you can get, you know, kidney stones, you can get calcification in your soft tissue, in your muscles. So,
And bones can also get cause if there is too much.
and too much calcium actually does the reverse to your bones. That's right. So, see, there's a lot to know about supplements. And, you know, I think we tell ourselves, you know, because we read and, you know, we don't want weak bones, and so we take something like calcium, or, you know, we take many other supplements. But it's like a medication. So if you're not sure of how much you're taking and what you're taking, you know, then you really should be talking to your pharmacist or your family physician, because it's doing things in your body, and it can interfere with medication, like prescribed medication. So, you know, when you go to your doctor or pharmacist, every now and then, at least once a year, minimum, you should be reviewing everything you're taking to know, you know, what. So, you know, for example, you should never take calcium and iron together. Calcium interferes with the iron absorption. So, you know, so there's all sorts of little things you need to know. And you know, we read things and we think, oh, vitamins and minerals, I'm going to be healthy and I'm doing something good for myself. But A, you could get too much, or B, you're not really getting enough, or it's interfering with something, and you know, so
It's true, because my mom recently, she was starting to take calcium again, and she says, I can't take this until an hour after or before whatever certain pills. I said, oh, okay, I didn't know that.
yeah.
Because you think of calcium, oh, it's just milk. You think of it as milk. That's
Yeah.
how I took it. But now I'm learning that
Yeah.
you have to be careful.
Yeah, lots of things to consider.
It's not a glass of milk, it's a supplement, it's a medication.
It's a medication.
My doctor just took me off calcium.
Okay.
I take fair amount. I 3 to 4 glasses. That's why I was asking.
And you're good.
Yeah,
You're good.
I'm good.
You're good.
She shouldn't have to take a supplement.
No, that's why I'm a doctor.
That's why you don't told me.
And because of the cardiac risk that is coming out now in the research about that mega dose of calcium, that makes sense. Because if you're getting your daily recommendation through your milk drinking, yeah, you don't want
Well,
to.
that's why I asked you.
Yeah, you don't want to get over.
How much would,
From 1 cup of milk, you're getting about 33% of your daily.
oh really, from 1 cup?
From 1 cup.
Okay, I'm good.
You're good.
Maybe you should cut back and eat other things.
I do eat other things, but I don't know much paper.
So, what about vitamin D?
Also crucial.
Also crucial. So how much do you need? So it's the same for men and women. Between 51 and 70, you need 600 international units. And over 71, you need 800 international units. And the daily maximum that Health Canada is suggesting is 4,000. Like, you really shouldn't go over that. Okay? It's a lot. I'll let you guys copy that now. Yes. Yeah.
Some people don't absorb vitamin D.
No way.
No, there's.
Is that right? I
Is
just
vitamin D or calcium?
It's calcium. Now, are we good with the numbers
I
here?
have a question.
Yeah.
If I am taking the capsule of glass, there is some vitamin D there.
That's right.
Can I take a separate vitamin D too?
You could, but let's,
My doctor told me I have to take 1,000 a day because
Why?
I'm missing calcium.
yes.
Then
Yes.
now I take 500, but sometimes now I take 1,000. I can
Okay.
take 1,000 once, or
Right.
because it's so small, I can stop that.
Okay, and we'll talk about that.
Okay.
Vitamin D, it's the same thing. For one thing, vitamin D is very difficult to get from food. It's not found naturally in a lot of foods. Okay? Older adults also produce less vitamin D through their skin, or if you're in the sunlight, you get vitamin D from the sun, but it's harder for older adults to synthesize the vitamin D from the sun. And if you're dark-skinned, it's even more of an issue. We live in it.
Because they don't absorb the
Yeah.
rays from the sun.
Yeah, as
What about
much.
we are a hot country, eating the same?
I think so.
Yeah.
But you're going to be exposed to more sun. See, we're in a northern climate here in Canada, and that's the other thing, we don't get enough sunshine here.
That's why we like the beach.
That's why we like going to the beach. And everybody feels better, right?
But you burn quickly.
But you burn, and that's the thing, so we put sunscreen on, so we're not getting the vitamin D.
off your skin. It's a vicious circle.
It's a vicious circle.
And now we put
Exactly.
a lot of sun cream too.
That's right.
Yeah.
We put sunscreen on, so we're not absorbing, we don't get enough sun throughout the year to begin with.
And
So-
I think the Health Canada, I don't know, I'm not a newcomer in this country, but that's one thing they should tell newcomers to do is to take vitamin D. Like, I had a friend from Ethiopia, And he only found out a few years ago that he should be taking vitamin D. And now he has a child, and I said, it's important now, because we don't go out in the sun as much. But they forget to tell people, and then they're not feeling as good because they're in the cold country.
And vitamin D, the research that's coming out, there's a lot of research coming out about vitamin D right now. Yes, it helps calcium, the absorption of calcium for strong bones, but there's a body of research going on that they think it does a whole lot more for our body in terms of reducing cardiac risk, cancer risk, our emotional health. There's so many things, and I think in the next few years we're going to see more and more research coming out. And some of the researchers are actually, the people who are involved in the research are taking much more vitamin D than is recommended here. This is Health Canada's recommendations, and it's very probably conservative. And older adults who might be more at risk for fracture and are a little frailer, a family physician might even up the dose of vitamin D.
Just like my girlfriend, she's 47, and we were discussing vitamin D, and I told her I think I don't want 1,000 UUI, and she said, oh, my doctor tells me to take 2, and I said, are you sure? Because, when she said double, I thought, are you sure? You're scared that she's having too much.
Yeah.
And she says, he told me that now it's very safe.
Yes.
So,
Yeah.
and B12. I have to tell you, my doctor told me to take B12 because as we get older, we don't absorb the B. And the way she said it is the first 2 weeks, you take B12 every day for 2 weeks. Then you only take it once every second day. And you can keep on taking it. But that's because when she took my blood test, she saw I was lacking in B12.
That's right.
And I said, well, why is that? She says, because as you get older, your body doesn't absorb it as much, so you need to take it some.
And vitamin B12, it's what they gave to you on your body. Why you need vitamin B12?
Why? Why? Because as you get older,
Okay,
your body just does not absorb the B as much. And if I remember, it was, I think it's 100 or 200 mcg microgram. See, I'm not good. You'll have to ask your doctor. Ask your doctor.
That's the thing.
That's the main
It's also
thing.
D3. What's the difference?
Yeah, D3, often you see that.
Yeah, it's just the
Same
source
thing.
of vitamin. It's just where the type of vitamin D in.
And what source is that?
I thought that was B, maybe the same complex B.
No.
I don't, I'm not a chemist, so I don't know all where they derive, but vitamin D, I think D, let me see if I have it here. There, one is, oh, no, I'm thinking of fortified. If things are fortified with vitamin D, if it's in a animal-based product, then the vitamin D is animal-based. If it's in something like a soy milk, then it's going to be plant-based. That's all I know about the source of vitamin D. You can have milk or soy milk. Well, okay, here's the thing. Remember back here, I said this is how much you need daily. So Health Canada, through their research, says that through the course of the day, through what we eat, we get about 200 to 300 international units from our food in, whatever it is we're eating. But it's not enough.
So what are the food sources? There aren't very many.
There aren't very many, and we'll go over that next week. At the bare minimum, what you need, everybody should be taking 400 international units if you're over 51 and over. So if you're on a calcium supplement, you might have the vitamin D already there. Okay? If some physicians might recommend more, and again, go with what your physician is recommending. Okay? But for sure, we're not getting enough from our food or from the sunlight, so we have to take the supplement. It might not. And that's why you have to read the label of your supplement, and also look if you're taking a multivitamin. Look at how much vitamin D is in your multivitamin. Okay? Yeah, there's a lot to know.
Also, they said something about multivitamin.
We can't hear you.
It has some side effects too.
Oh, I'm not aware. I know there was some research lately that came out that said multivitamins for men reduce the risk. I thought it was of cancer, but I don't know.
What about the tofu and soy products? They said women with non-violent should take it. Still there are research going on. They said it causes breast cancer.
Well,
Sorry.
yeah. We'll talk about the food next week.
Okay.
Whatever causes breast cancer is people that are healthy and they get breast cancer. So.
Yeah, there's, you know, there's a lot of research and,
Confusion.
yeah, and, you know, next week, I think we've covered what we want to cover today. I have a little quiz that I'm going to have you guys do, and then I'll hand out some of the resources for you. I think the message that you need to take away from today is, you know, take a look at, if you're on supplements, take a look at what you're getting, okay? Because you don't want too much. After next week's session, the goal will be that you'll know what the good sources of calcium are found naturally in food or in fortified foods. Because ideally, if you can get your calcium from food, like you have found out, you don't need that supplement. And A, not only is that a money saver, but B, you wouldn't want to be taking over the daily maximum, because that's the working in reverse for you. Okay. For somebody who isn't taking a supplement, what we would want to know is, are you getting enough calcium from your food? And if you're not, what would be some easy ways that you could improve your nutrition and make some good choices that, you know, it's easy to do.
But when I drink milk, I'm always sweating.
You're always
sweating?
Sweating.
Like from milk products.
So I have no problem with cheese.
Yeah. Yep. Well, we'll talk about some of those other choices.
Does rice milk have vitamin D? Rice milk?
We'll talk about that. What I'm going to tell you, but you know what? What I'm going to tell you is, again, it's all going to come down to reading the label.
Yeah. That's
Because remember, what we've said is vitamin D isn't found naturally in most foods. So it gets added to milk. It gets added to other products.
Okay.
But you have to read that label to know if that's in there or not. Okay, so
And also we should check our medications, because I think
yes.
this might affect the medication.
I think if you started a supplement and you haven't talked to your family physician about it, it might be something that you should
I wonder if
have
they
a
know.
conversation.
You wonder if they really know these things.
I do.
Yeah.
I mean, my physician recommended iron, but when I'm trying to get Oscar, how much should I take? because when I went to look at all the, find out about it, I found out different milligrams, different doses.
Yes, and
So I
there's-
went back to her and said, what should I take? Oh, well, you should go by what's in the box.
On the books? On the bottle?
because iron is another one. If you look, it's a compound. And if you look at the label, it'll tell you how much elemental iron is in there. So, if you're spending your dollar, you want to get the best value for your dollar, right? So, and you want to be knowledgeable, because you might think, maybe 1 month you buy this brand, and then the next month you buy this brand. So this month you were actually getting a different amount of iron than the next month, right? Because an iron pill is not an iron pill. You really, just like calcium, you got to read the label and check to see how much you're really getting.
So the key word is elemental.
Elemental.
Yeah.
It's elemental,
For calcium and iron.
And iron.
Okay, so check your labels.